really heartwarming to see this group. So many of you have supported this project since the very beginning here. We welcome you as we celebrate together. Alice, asset limited, income constrained, employed. It's just the vehicle that we need in Minnesota to raise the awareness level of the number of Alice households we have in this state. Over 600,000 Alices living paycheck to paycheck. They are serving us every day in every place that we go, but not being able to make ends meet. A major United Way goal is to enable everyone in Minnesota to thrive. And now we have the data that Alice brings us, so that every sector of our community will be able to diagnose the problems and work towards solutions. Alice is a national project started by the United Way of New Jersey, now being used by 30 states who have had much success as their state legislatures and businesses become aware of the issues. The United Ways of Minnesota have had a terrific team of people planning to bring Alice here and learning how to use the data from Alice. We have had a very active steering committee. Raise your hands. A research committee. Raise your hands. And a marketing committee. Plus Greater Twin Cities United Way staff and staff from around the state engaged in planning over many months. I see United Ways here today from Chisholm and Grand Rapids and St. Cloud and Marshall and Rochester and Northfield, Rice County. And I know there are others, I'm sorry if I missed you, but we have 33 United Ways across the state backing this whole project up. And now we are launching our first report. We will give away the data to all who can use it as they work and plan, from Minnesota government offices, the legislature, schools and universities, businesses, large and small, cities, nonprofits. Our goal is for all of us to work together, sharing information and programs so that everyone here can thrive. We need all of you in this place today, and your organizations to be a part of the Alice team. Welcome and thank you.
Thank you so much, Doris, for setting the table for our time together today. I know earlier Biddy had led you through just a tiny exercise about who was in the room and who was below the Alice threshold. That is important because this data set just is not a set of numbers, but it really represents people's lives and everyday experiences. For example, 40% of the state of Minnesota is below the Alice threshold. So roughly, this side of the room are struggling every day to make ends meet. And that is important. Again, it's not about an abstract data point or anything like that. It's important because 40% is a big number, and that could also mean that there are people in our families that are struggling to make ends meet, our neighbors, colleagues, friends. So this has real implications for our lives. It's not something that we can distance ourselves from. And someone who has come up here and to really put the face to the everyday experience for Alice, people who are living below the Alice threshold, is Herminia Mack. Herminia has been living in Owatonna for 28 years. She is currently working as a healthcare and early childhood education professional and is finishing her bachelor's to master's integrated program in business management in healthcare. She is happily married, raising a blended family, and is heavily involved in her community and her church with singing and children's ministry. Let's welcome Herminia to the stage.
shoes, but I'm still not tall enough. Sorry if you could hear me. Oh, wow. I just want to say thank you again for giving me the chance and the opportunity to be here. It is a great honor and privilege, and timing definitely is the essence. I will tell you, being a living, true walk, and many other examples that even have it worse than myself. Being up here is just to give you that chance and opportunity to summarize so much that's happened even during the pandemic. A little summary about myself and working in healthcare for over 28 years helped me understand and emphasize so much that there's so much for families, that how could I stop giving? Where can I be used? Even when I was ill so much through the pandemic, I knew to keep pushing forward. I had to prepare myself that there's always going to be some area of someone not agreeing, and I had to learn to choose to agree to disagree. That being said, just in representation in what Alice has out for our community, we're asking in generalizing, just knowing that this community itself is what's needed. As I shared earlier with Annette and the team, when tragedy events happen, you feel like a scattered puzzle that is shattered and you don't know how to start and put yourself together. But when everything comes together as a community, how strong in a shield and holding that umbrella, for example, when that storm hits, it's amazing to know what you've done in impacting even in my life. I was always a very prideful person, took great pride in everything I have and wish I still do. But that being said, with that being scattered puzzle that broke that beautiful picture that was worth thousands of words, I too was struggling through that. Seeing many family members through the pandemic in healthcare, when being told and telling patients as well their family could not be here because of rules and regulations we had to fall by. It was such a blessing and honor to be able to serve and be an ambassador for that family member at that moment. Even though our hours of wages and whatnot, to me, I could be off the clock and would be working there for free. That being said, again, the logistics of it all is doing the math. Working in the process and the programs that I had been through in our community extends itself outside of our community. The different programs that we had that helped me understand the tools and when I needed it when tragedy events had hit. Through the process, I lost my son, his father, my father-in-law, and I also lost my sister. All one by one. I just knew I had to get back up. I had to get back up because there was a goal. When there is fundraising and events that happened in those times, when the fundraisings come, I didn't want any of it. I wanted to give more than anything that was given to me. Time management was huge. That I knew to go back into furthering and advancing my career. In that being said, I knew that working behind the scenes and working in different departments, cross-training, doing a self-initiation evaluation for myself, knowing that I want to know how to manage in healthcare, whether it's business or whether it's in healthcare management. I am nothing without you. All of our teams have to build together to be unified, to be able to have a strong backbone. That being said, I am so thankful again to be where I'm at. Currently, I've worked for Allina for over 10 years. It'll be almost 10 now, let me correct myself, 10 years now in April. I feel so honored to still be part of such a large community. I cross-trained in with Mayo Clinic, got to learn in how Mayo processes, and I am so honored to have been part of the team with both. They come together as well in healthcare. You think of just this building in itself that we're in. It took a lot to build this, and they don't have the machinery that we even have right now. But they did it, and we're here. So I'm here to tell you, thank you so much for investing time into the community, into Alice, and knowing there is so much in this program to do your research on that I don't have all the time to speak of. But I just want to say thank you again for giving me the opportunity to be here as a living example to continue to move forward.
The next speaker I would like to bring to the stage is Michelle Roars. Michelle is the Senior Vice President of Strategies for Alice and is a part of the United for Alice team. What's special about Michelle is that Michelle is a native Minnesotan who relocated to New Jersey. So basically she switched Prince for Bruce Springsteen. So I'm not gonna judge you. I mean, the boss is good too. The boss is good. She leads the strategic direction of 2 key initiatives to support Alice both in New Jersey and across the country. Her work includes program development, goal setting, and evaluation, and sustainability planning. Michelle is a member of United Way of Northern New Jersey's senior leadership team, where she's a recognized forward thinker in systems change initiatives and in building strategic partnerships in education and workforce development to promote better opportunities for Alice. Roars has a master's degree in social work from Fordham University School of Social Services and a bachelor's degree in social work from St. Catherine University right here in St. Paul. Prior to United Way, she championed victims' rights with the Morris County Prosecutor's Office and Jersey Battered Women's Services, both in New Jersey. Welcome, Michelle.
I have to make a correction, Stephanie. I am actually a super huge Prince fan and was devastated at his loss. So true to my Minnesota roots, this is where my heart is, always. So thank you for having me here today. Today really marks a fantastic day for the Alice movement. Minnesota joins 30 other states, including the District of Columbia, in this national movement. Alice started as a very small research project in my county, Morris County, New Jersey, back quite a few years ago. And it started, with a situation of trying to understand our local community. Morris County, New Jersey ranks as one of the most wealthy counties in the country. And interestingly, while we have a very low poverty rate, our social services were actually under quite strain. We had a very high demand for it. We continue to have a very high demand for social services. So our United Way embarked upon the opportunity to research this and try to better understand our community and what the dynamics were going on there. And thus was born Alice. Here we are today, nearly 15 years later, and as I said, Alice has become a national research project as well as a national movement. And the data is now informing work and informing great change across the country, and looking forward to that great change here in Minnesota as well. The poverty rate, as you probably all know, really only tells a part of the story of financial hardship across our country. Stagnant since the 1960s, think about that, it was actually before I was even born, the poverty rate was set. And it was set as a static numeric figure across the country to describe financial hardship in our country. But as we know, that doesn't tell the full story. So Alice really became a vehicle to paint a more clear picture of struggling households. ALICE, which we now know stands for Asset Limited, Income Constrained, and Employed, does in fact represent a demographic of hardworking individuals in our communities. These individuals oftentimes work 2, 3, even 4 jobs to be able to sustain their family household. And even with that, they're struggling to get by day to day. Living paycheck to paycheck is a very hard thing to do. And many times, Alice does not qualify from public assistance or social service programs. And yet, as I said, they continue to struggle. But through the development of the Alice measurements, an unbiased picture of financial hardship has emerged. We've created essentially 2 different categories of Alice budgets. A survival budget, which includes the bare minimum to live in the current economy. This reflects the bare minimum to live and work in the current economy that includes housing, childcare, food, transportation, healthcare, technology, and taxes. On a survival budget, Alice does not have the ability to have savings or invest in their future, be it for college or retirement. On the other hand, we have an Alice stability budget. The stability budget is something that supports a viable household with a contingency of having some savings. A little bit of comparative, on average here for the state of Minnesota, a household of 4 with 2 adults and 2 small children would require $77,000 to be at that survivability level. Think about that, $77,000. And they're not able to get by. On the stability level here in Minnesota, for that same family of 4, it would require a budget, an income I should say, of $132,900. Might seem like a lot of money, but when you're trying to put 2 small children through childcare, support a family, it's quite difficult. And remember, that's a combined household budget, income of 2 working parents. In Minnesota, as we've heard, we have approximately 40% of folks that are living under this ALICE threshold. Interestingly, Minnesota actually ranks quite high, is the 10th lowest state of having ALICE in their population. Comparatively, Alaska has 33%, and Mississippi has 52% of folks living under the ALICE threshold. Comparatively, our neighbors here in South Dakota, North Dakota, Iowa, and Wisconsin, they're all hovering around the 35 to 36 percentile. Many of our fellow Minnesotans who work jobs that are critical to our economy are struggling. It's the personal care providers that we've heard about, nursing assistants, retail workers, cashiers, restaurant workers, and childcare providers. And depending on the family composition and the circumstances that those families find themselves in, we find ALICE actually in all types of professions. I'm so grateful that Hermania shared her story. Many of us here have our own stories. We ourselves may be actually part of the ALICE demographic. We have friends and family who struggle on a day-to-day basis. And we certainly interact with ALICE throughout our day. I too grew up in an ALICE household. My dear father was an elementary school teacher, and he supported a family of 8. My mother was not working while I was growing up. My brother, who is here today with me, can vouch that my parents struggled to keep our family afloat. Balancing the household budget was in fact a chore. They were ever so grateful that my father's job came with health care, good health care benefits, and even a pension. Not something that ALICE typically can count on. And I could go make some jokes about my mom doing coupon clipping and even eating government cheese back in the day. I think some of us older folks know what government cheese is. But it's no joke. It's no joke to live in an ALICE situation. So my fondness for Minnesota is that there's such great urban, suburban, and rural communities all across the state. ALICE households across the state on a glance look like they're all in that same 35 to 40 percentile. However, if we take a closer look and peel back the onion, there's actually quite some disparities across the state. The extremes, Cook County is actually doing quite well with a lower percentile of 27% of their households. But Menominee has 54% of their households struggling under the ALICE threshold. In Beltrami County, they're kind of in the middle at 42%. But taking a really close look down to the township demographics, we find that in Black Duck City, 70% of the households in that community are far below the ALICE threshold. Another way to look at the data is through the lens of race. While the white population is actually coming in at about 34% of the population struggling, The Black and Native American communities are struggling at much greater rates, closer to 60% for each of those populations. And as we heard, the single female-headed households are really struggling at a 72% rate that are below the threshold as well. So family composition is taken into consideration. So enough about data. You can certainly find a lot of it in the newly released website that's being launched today. The tool is really fantastic. There's a lot of great interactive ways to look at the data. And there's some examples of how you can look at it to very specific communities down to the zip code level and do some comparisons across the country. So what's the big deal about all this data? I think we're hearing today that there's some changes that we can make and some things that we can do. United Ways around the country and here in Minnesota are driving this movement, raising awareness, better understanding our communities, and creating change for a better tomorrow. Some of this change that's happening within the local United Ways is they're changing their community impact work and they're directing their funding in new ways. Some of the changes is also happening within community-based programs, such as social service agencies and hospitals, and they're also changing their programs and interventions to meet the needs. Yet some of the biggest change will be happening here in the State House, this beautiful Capitol that we're in today. Just want to give one quick example. In one of our neighboring states of Michigan, that's been part of the ALICE movement for a few years now, they've actually been using the ALICE data to help drive some of their work, particularly around their initiatives to reduce poverty. They realized that they need to look at the ALICE population to be able to address some of their poverty issues as well. And in Michigan, for their fiscal year 2023, they proposed and actually did pass tripling their earned income tax credit. They boosted the earned income tax credit that lifted 22,000 of their Michigan residents out of poverty. It was a huge feat, and it's something that we can continue to look to do. They also used it to drive the building and preservation of over 75,000 affordable housing units, and also boosting access to affordable childcare, which is crucial, as we know, to working parents in our communities. So all that being said, I'm really delighted that Minnesota has joined the movement, and really looking forward to you all having access to the data and digging in and really looking to the future, working together to make a brighter day for ALICE. Thank you.
Thank you so much, Michelle. One of the things I want to tease out from her final moments on the stage is she was talking about the possibilities of this data. Remember my earlier comments, I was talking about the possibilities and the opportunities with ALICE, and she gave you some examples of what other states are doing and locales are doing across the nation to really drive transformational change in their communities and in their states. Well, that is the possibility and that's the potential that ALICE has here. And one of the partners, it is done through partnerships, and one of the partnerships that can support understanding, driving that change, understanding the breadth of of the human experience, but also driving transformational change is with our 211 and 988 data. I will allow Julie Ogunlier, who is the director of 211-988, to explain a little bit more about 211 and 988 lines, but I want to just give her a little background about Julie. Julie leads United Way's 211 Information and Referral Program and 988 Suicide Prevention and Crisis Lifeline. She oversees our local 211 and 988 contact centers, builds strategic community partnerships, and lift up community insights in support of advocacy and systems improvement efforts. She has been with United Way, Greater Twin Cities United Way, for 16 years and is on a mission to make it easy as possible to ask for and receive help when it's needed and to enable community-centered and data-informed decision-making. Please welcome Julie Ogunlier.
Good morning, everyone. And yes, I have the privilege of leading two critical services across the state of Minnesota, particularly our 211 Resource Helpline, that has thousands of resources for Minnesotans, depending on where you live and what your needs are. You can reach out to 211 at any time to get connected to local services. And again, our 988 resource or crisis lifeline is a place to reach out for a mental health crisis. Anything you might need, please do reach out. There's somebody there who cares and wants to speak with you. So with that in mind, one of the ways I'm really excited to delve into the ALICE data and research is to really overlay it with what we're hearing from a call center perspective. We hear from thousands of Minnesotans every year. In fact, last year was 300,000 people that reached out to 211 looking for things like, basic necessities like housing, food, clothing, childcare, the things that we know we all need in order to really thrive and have a stable life in this community. We also know that cost of living varies depending on where you live. So housing in the Twin Cities versus somewhere else in greater Minnesota is going to be different, and you're going to have a different experience based on that family income. And so, we want to help people find those resources that supplement their income based on their own family needs. So we know housing, for example, is the #1 reason that people reach out. A lot of our housing programs have our eligibility is based on the outdated federal poverty guidelines. And so we get calls from a lot of people who are first-time callers to 211, people who maybe never asked for resources before in their lives and are finding themselves in a position to say, I need something to supplement my family income. I'm not able to pay all the bills at the end of the month, and I need something to supplement that family budget. And so when they reach out, we look for different services that might be available. And unfortunately, a lot of those housing programs are based on that income threshold. And so the ALICE households that we talk to are some of the hardest to find programs that are going to be eligible, if they're going to be eligible for, and that are going to be able to meet those needs that we know exist out there. So we have a lot of great data about what people are asking for, where they're calling from. We have some really great 211 data that we can then match up with some of this ALICE data. And that's a really exciting opportunity to think about how do we share a more comprehensive picture, a more complete picture about the realities people are facing in our community and what a family budget really looks like and what that means for the services that are available in their area. A lot of times there might not be a program or a service available in a given area. And so we certainly do our best to know about them and connect people to them, but I think that ALICE data will really give us a unique opportunity to look at where some gaps are, and I think to really look at it from the experience of a household when they're reaching out and how they can connect to help. I do love that ALICE as an acronym is a person's name, right? And I think that is really what this is all about, is that person, that family unit, to really make sure that we're centering the people that are in our state and the experiences that they have in reality, not what the data says or what federal poverty guidelines say should be your experience, but to really look at the realities and how are we meeting those needs and how are we supporting our neighbors and our community to make sure that there are resources, that there are help there when somebody needs it, because we all find ourselves in that situation where we might need help sometime. We might need that extra boost in a certain month. And so really to look at it from a personal and human perspective and make sure that we're using this information and data in partnership between 211 and ALICE and a lot of other great work happening out in our community to make sure that we are representing that realistic experience to our policymakers, to our programming, to funders, to others in the community that have resources and influence to be able to make these changes. So really excited to see everyone here today because you are all those people who have that influence in your own right, and so excited for the launch of ALICE and the opportunities to come in partnership. Thank you.
Thank you so much, Julie. As you heard Julie mention, talking about like the possibilities of integrating this data, overlaying that data with our 211 and 988 data, and what that can do is provide more of a complete picture. And why is that important? Is because as we are looking to advocate for policy change, legislative policy change, it informs policy solutions that actually meet the need instead of do it in part, because like she said, the federal poverty levels or the federal poverty guidelines don't provide a clear picture. The data that we currently have access to doesn't provide a partial picture, but being able to layer this data will definitely give a bigger picture so we can have and advocate for solutions to meet the actual needs of the community. Next coming to the stage is James Burrows II. I distilled the bio because if I read everything, we only have an hour, we'd be here until tomorrow if I read all the things that he has done. James Burrows II is the Senior Vice President, Government Community Relations, Chief Equity and Inclusion Officer. That's his title at Children's Minnesota. Say that 5 times fast. He joined Children's Museum in 2019 as its first Chief Equity and Inclusion Officer. Mr. Burrows, prior to Children's Minnesota, Mr. Burrows served in the office of Governor Mark Dayton, where he was the state of Minnesota's first Chief Inclusion Officer. Mr. Burrows has a Juris Doctor from Georgetown University Law Center in Washington, D.C., and completed his Bachelor's of Arts in Political Science at Morehouse College in Atlanta, Georgia. He is a proud father of Teresa Ann Burrows. Come on to the stage, James.
Good morning, everyone. How are you doing? Well, first of all, I'm gonna blame Stephanie for reading that bio. I didn't want any of that to be read, but I do thank her for that and the welcome. I also want to thank Shannon Smith-Jones, the Community Impact Senior Vice President at United Way. I want to say this, it's glad to be back in the Capitol. I used to work 2 offices down as the Chief Inclusion Officer under Governor Mark Dayton. It's a pleasure to be back. But it's only a pleasure to be back because Shannon called me up and said, I want you to meet somebody named Alice. And I said, who is Alice, Shannon? Well, Shannon known each other like 20 years, and she knows that I'm about doing work, not about just reporting data for the sake of reporting data. She told me who Alice was and the new data and the way we're gonna look at the data and how it's gonna help people be their fullest self. And I said, Shannon, you know, that's cool, but we've had a lot of Alices in the 32 years I've been up here. We've had data carved this way, this way, and we didn't change anything for community sometimes. Now you want me to go back to community and say Alice is great and can do great things, but can you promise me that Alice will change the lives of people in Michigan? Will Alice change the lives of people in DC? Can I go somewhere and say, you know what, this Alice data is gonna help us create policy, create legislation, and create a new way of life for you? And she said that could happen. So that's the reason I'm here today. I want to say that Children's Minnesota is a hospital system. I used to be on the board of Children's Museum, but we're not that. We serve about over 100,000 patients every year. We're the largest exclusively pediatric healthcare system here in the state. We have over 5,500 employees. And the thing you should know most is that Alice data will help us be better healthcare providers for all the children in this state. 80% of what happens to kids in their healthcare journey happens outside of our hospital system. Those things are called the social determinants of health. That's employment, that's education, that's food deserts in the neighborhood, that's climate that's happening in the neighborhood, that's the culture in which you're raised. We can only be responsible at the hospital for 20%. So imagine if the Alice data you talk about could help change that 80%. It could change the world for those kids. It could change the world for vaccines. It change the world for diseases like sickle cell. It could change the whole healthcare system and turn it on its head doing a positive thing. So when we talk about Alice, I want you all hopefully to take Alice with you. Bring Alice over to PPL. Bring Alice over to Habitat for Humanity. Bring Alice over to Children's Minnesota. And say, James, we got Alice with us and we're gonna do some work. We're gonna do some work because we're gonna change the trajectory. So the 41% of patients of color that you serve at Children's Hospital that has risen over the last 10 years to about 15%, those patients and families will no longer have to say, man, am I gonna be treated differently because of my race, my ethnicity, my gender status, my gender identity. They're gonna say, you know what, with Alice and Children's, we're gonna make a difference here in the Twin Cities. I wanna say this to you. I'm the same person asking you to hold Alice accountable with all these folks, but I want you to hold me accountable and my employees accountable at Children's Minnesota. If we're not doing things to create an environment where the people that you serve are feeling safe, wanted, valued, including getting the best health care, let us know. Because Alice can be the person or the thing or the entity or the non-binary entity that can help us all be better in Minnesota. I've been here 32 years and I'm not interested in dating many more Alices of the world, Shannon. But I trust you United Way, and I trust that we're gonna make a difference in the kids and families here in the Twin Cities and beyond in Minnesota. The last thing I'll say is this. Sometimes people have taken an Alice and put her in an urban neighborhood and said, Alice is only for you. And they said, you know what, you can't talk to Alice, don't talk to people in the rural neighborhood. And they said, you know, Alice, you can go to the rural neighborhood, but you can't talk to the urban folks. Alice needs to be for everyone, so there's no pitting us against each other. Alice has to be for those whose first language is English. Alice has to be for those who are immigrant populations whose language may not be English. Alice has to be for all people of all gender identities as well. Alice has to be welcoming and inclusive. So thank you for the time to talk about Alice. I look forward to working with her, they, them, he, or him, whenever I get her pronouns or their pronouns right. I want to make sure that we're doing something in Minnesota to make a difference for these families. Thank you very much.
Thank you so much, James. Honestly, after that, we can just go ahead and go home. But we do have one more special guest that wanted to be here, was excited about Alice and the possibilities, but due to their campaigning schedule, they could not. So we have a video greeting from Senator Amy Klobuchar.
Hello to all my friends at United Way. I sure wish I could be there with you in person for the release of your Alice data set. This critical information is going to bring to light the realities faced by countless Americans who work hard yet still struggle to make ends meet. And while your findings may take the form of data, we all know your work isn't only about the numbers. Now, we need the data. That's why you did this work, because we need proof points to make the case. But under that data, it's on you and me to also explain that it's about real people with real stories. Our moms and dads, brothers and sisters, friends and neighbors, you are driving meaningful change for these families. Importantly, your data will give lawmakers in Washington and in St. Paul and in state legislators and in city councils around the country a valuable tool as we fight for policies that support families and build a future where every American, no matter their zip code, has the opportunity to thrive. Why does this matter? Because efforts like United Way's Alice research shows that through evidence and empathy, our nonprofits are leading the way to a brighter future for families from all walks of life. Because of you, I know that future is possible. So I invite you all to visit my office sometime. Every Thursday morning when the Senate is in session, we invite all of Minnesota to breakfast. And if you come by, you will see a picture hanging on the wall. It's a drawing of a woman who is holding the earth in her hand. It's being handed to her by an angel. And the words read under the picture, "In my dream, the angel shrugged and said, if we fail this time, it will be a failure of imagination. And then she placed the world gently in the palm of my hand." Well, the future is in the palms of our hands. And I know we're not going to fail because there is no lack of passion, no lack of ambition, and no lack of imagination among everyone gathered today. You have what we dearly need. Passion and imagination to get this done, and to get it done in today's world with proof points, but also with a heart. Congratulations on the release of this important data, and keep up the incredible work. Thanks, everyone.
So in our brief time together, we learned a couple of things about Alice. We learned where it was created, how it was brought to the state of Minnesota. the hours, the labor hours and sweat equity and intellectual capital that was invested here, the lived experience and the faces behind Alice, the possibilities that exist of integrating it with other data sets to give a fuller picture to really advance a meaningful and transformational policy. But then also we learned about a charge from Senator Amy Klobuchar as well as from James Burrows to really use this data, to not just let it sit on a shelf and get all dusty and say, oh, we have this nice thing that we did, but to really use it in our day-to-day work. So you know there's a call to action. If anybody knows me, I believe in call to actions at the end of everything that we do, because it's not just about us knowing, it's about us doing. So one, we just want you to stay aware there. This is not the end. This is just a launch, the celebration to culminate and recognize the work that we put into it. But then also the work really begins after today. So we want you to stay tuned for more updates around Alice from the State Association as well as from your local United Way. Again, there's some other ways you can get involved. You can get access to the Alice report. It is available. You know those little cards that you held up this morning? There's a QR code on here. Please use your phone, scan the QR code to access the report. We also want you to talk to your elected officials and tell them about Alice. We have already engaged elected officials and we're going to provide them with a copy, but it's great if you also call your elected officials and let them know about Alice and begin the conversation. We also want you to talk to your local United Ways. We have a lot of local United Ways in the building. This is an opportunity for you to get to know the folks who really understand the challenges happening in your county and in your region. Then we also want you to learn more about our advocacy as we go into elections and the legislative session. And finally, feel free to talk to anyone on the steering committee with the Ask Me badge. Where are the folks, the steering committee folks with the Ask Me badge? Okay, we got some folks around here, yep. Those are the people you want to talk to for more information as well. I think that is it. So thank you so much for coming and have a great day.